Temperature above 100.4 Fahrenheit is considered a fever in children. Fever is the body's natural response when fighting off an infection. Parents get worried when they see their baby has a fever. In this video, we will discuss the causes of fever in babies, how to manage the fever in babies, and when to see the doctor. What causes fever in babies? A fever is not an illness but is a sign of any other illness to the baby. Common causes of fever in babies include cold, ear and throat infections, pneumonia, respiratory infections due to flu, bacterial infections, urinary tract infections, or chickenpox. Overwrapping of the baby, warm environment, and vaccinations can also cause the baby's body temperature to increase. How to measure a baby's temperature? There are many ways to measure the baby's temperature. You should use only a digital thermometer to measure the baby's temperature. Rectal thermometers provide the most accurate temperature reading, while the ear thermometer, forehead thermometer, and underarm readings are handy but are not 100% accurate. How to make the baby comfortable in fever? If your baby is younger than 6 months, offer extra and frequent feedings to the baby. If the baby is older than 6 months, offer clear water and other fluids and keep the baby hydrated. Monitor the signs of dehydration in babies such as dry skin, less urination, and chapped lips. Do not overdress your baby. Let your baby sleep and rest as much as possible. Avoid cold baths and use only lukewarm water to bath the baby. If the baby doesn't like to eat during the fever, don't force them, but make sure the baby remains well hydrated. Don't offer any fruit juice during the fever, but you can give electrolyte drinks to the baby. Serve all foods warm to the baby. Give anti-fever medicine to your baby as prescribed by the doctor. When to see the doctor? If your baby is younger than 3 months and has a fever, then seek medical help immediately. If your baby is older, then visit the doctor. If the baby has trouble breathing, rashes, dry mouth, dehydration, or if the baby is cranky and non-responsive. If fever is above 104 Fahrenheit, if you are giving antibiotics but the fever lasts more than 2 days, if the baby is vomiting or has diarrhea, the doctor will give the antibiotics or vaccination to the baby. But if the baby has acute fever, some blood test will also be done to check the blood cells count. If you think symptoms are serious, then seek the medical help immediately. Happy parenting.